We are going to switch gears now and talk about an important topic, complex coronary disease. What is the disease and how is it treated? Well, let's get some answers this morning with our next guest. Please help me welcome to the show Dr. Owen Mogabgab with Cardiovascular Institute of the South. Welcome to the show, doctor.
Great. Thank you so much for having me.
Thank you so much for joining us this morning. Let's first start with the framework, right? How do you explain in layman's terms what complex coronary disease is?
Yeah. Well, over time with various risk factors, you can develop the slow, gradual buildup of cholesterol plaque in the arteries that supply the heart muscle with blood. And these are some of the most precious arteries of the body, and they're not ones you want to have blocked up with cholesterol. And when that cholesterol gets bad enough that it's starting to impede blood flow, patients start to get symptoms. They get chest pain, shortness of breath, maybe just decreased energy and fatigue when they do things. And in the worst cases, their heart muscle can actually start to get weak, and they can develop what we call congestive heart failure. But it's an important thing to recognize in this community. It's certainly something that everyone knows somebody who's either had a heart attack or had a stent or bypass surgery and has been subject to this condition.
And I'm curious, how is this disease developed? Like, what causes the plaque to build up? Is it because of our lifestyle that we're living?
Well, that's certainly a big part of it. There was a very famous study out of something called the Bogalusa Heart Study that was done many years ago here in Louisiana that looked, and we actually begin to develop cholesterol in our arteries at very young ages, even as young as 20 to 30 years of age. And it gets worse with risk factors. So if you smoke or have diabetes, high blood pressure, have poor diet, be overweight, a lot of these things can contribute. And we have high rates of these risk factors in Louisiana, and we see a lot of coronary disease as a result of that.
For sure. For people who may be watching this, who may have this condition, what are the treatment options?
Well, it depends a lot on the patient. So we treat the patient, not the anatomy. So if you feel bad, if you have chest pain, shortness of breath, or your heart muscle's weak or have heart failure, and you're having symptoms of coronary artery disease, that's when it's important to get treated. Patients who have no symptoms and feel great, even if they have some mild cholesterol in their arteries, just need to be take medicine, and they don't need any more than that. But the mainstay of treatment for coronary disease is medical therapy first. If patients have residual symptoms after starting medicine, the two most common things are to have stents, otherwise known as percutaneous coronary intervention, or to have bypass surgery. Essentially, the way it works with treatment is that if you have easy to fix blockages, stents are the way to go. If you have a lot of blockages or more complex disease, coronary artery bypass surgery is still the standard of care. Now, we do see a lot more often if patients can't have bypass surgery for whatever reason. They have other comorbidities, or they've had bypass surgery before, or their heart muscle is already too weak. Then you go back to stents again. It's not enough to just treat those patients with medicine and send them home suffering. We have great ways of getting stents in just about anything these days. The technology for providing opening up blockages in people with even the most complex types of blockages has gotten amazing, and we can offer patients that service.
And I wonder, doctor, is this something that's curable after the arteries are free of blockages? Is the disease now over, or can it come back?
Well, it's more of a treatment, not a cure. There's no doubt about that. And once the arteries are opened or bypassed in some cases, perfect, meticulous care of every risk factor is so important. So making sure the diabetes is perfect, making sure to never, ever touch a cigarette again. Blood pressure needs to be well controlled. All of those things will help it not come back, but certainly it is a treatment, unfortunately, and not a cure.
And what would you say is one of the biggest signs that, something might be wrong? Is it maybe that shortness of breath?
Well, in general, anything that has to do with heart arteries gets worse when you exert yourself. So people feel fatigue, shortness of breath, that kind of thing when they do things. A lot of times when they're sitting on the couch, they won't have a lot of symptoms. So when people get out and they're more active, now's a great time to do it. The weather's turning nice to get out and be more active and exercise. And if you feel lousy doing that, it's a sign that something may be wrong, and it's worth getting evaluated.
Definitely, for sure. Well, look, doctor, thank you so much for educating us this morning on this disease. And hey, if you have more questions about your heart health or this disease, you can log on to cardio.com. You can also contact Cardiovascular Institute of the South by giving them a call at 504-354-5252 or visit their location. They're at 1901 Manhattan Boulevard, Building A, Suite 200 in Harvey. Stick with us, everyone. A lot more to come when we come back.